Hey everyone, Dr. Derek Lawrence here at Revive Naturopathic Medicine, and today we're doing a COVID edition. I'm going to show you guys some shockwave therapy with Randy here today. I'll give you a little insight into the case. Randy, you're in construction and woodworking, right? Avid climber.
I am.
Yeah, so what we're dealing with is actually a forearm kind of hand and wrist issue where there's some acute kind of shooting pain, especially when there's contraction and holding wood up, correct? Right. There's been some previous injuries to the hand, ligaments from climbing, but today we're going to take a look at this, do a brief physical exam, and then do a shockwave treatment on Randy's hand, wrist, and forearm, and so that we can see how it's going to respond to that. All right. So let's talk about shockwave for a second. This is the probe we use, and if you can tell, there's a little kind of pneumatic, what we call piston, at the very end of this. And this piston moves in and out with some force, and that force is then transmitted into the tissue that you're treating. So in Randy's case, it's going to be his forearm, down into the wrist, and into the hand. So why does this matter, and kind of what therapeutic benefit does this give? When you think about this, think about dropping a pebble into a pond, right? And when you do that, you see the kind of where it drops in and the ripples that move out from the side of it. So that's exactly what's happening with shockwave as well. We're actually transmitting energy into those tissues. Why that matters is because this actually has been shown to reduce inflammation, improve growth factor presence, so it helps you heal and repair faster, and it seems to actually mute pain as well. So all three of those things are going to help, one, your forearm feel better, and two, help it repair faster, especially if there is a chronic injury there. So just so you know, Randy, this treatment should last about maybe 10-15 minutes. That said, we are going to treat a relatively large area here. So the total treatment time, probably about 10 to 15 minutes there. Most people feel benefit like right away. It'll feel looser, it'll feel like there's a greater range of motion. And of course, if there is acute pain, which in your case, it's kind of intermittent, right? So you'll be able to tell probably later down the road as you're using it. But a lot of people, especially if there's chronic pain, they're noticing that improvement while they're walking out the door. That said, I tend to recommend the kind of weekly treatments for 3 to 5 weeks, depending on kind of how long the problem's been there, and then just how it's progressing moving forward. All right, Randy, so we're going to get going. We're first going to put some ultrasound gel on, then that's just to lubricate the probe. So we're going to start off by treating right up here where your forearm flexors insert into your arm here, and this is called your medial epicondyle. And I know from our physical exam we kind of push on this area, and it's a little tender, right?
It is.
Yeah, okay. So you can put your arm and let it rest on your leg there, and we'll put a little ultrasound gel there. So this is going to be loud because there's actually a lot of kind of noise being made by the machine to make that pneumatic piston move.
All right.
And the way this is going to go is we're going to start at a relatively low intensity. And as long as it's tolerated, we'll move that up.
Okay.
What I tell people is that it may be uncomfortable, but it shouldn't hurt, right? We're not trying to cause pain here. So, but as you can tell, but even by palpating gently, and there's some tenderness in there. So it may be a little uncomfortable, but it shouldn't hurt, make the problem worse. We're going over bone, we're going over muscle, ligament, tendon, so a variety of different tissues here. And so, of course, we can't go very aggressive over bone. It'll hurt. So we'll turn it down when we're around there. Any other regions, we're going to kind of modulate the intensity of it based on your tolerance level. Okay? So let's get started. So, as you can see, it's pretty low. Want a little more?
I could definitely do a little more, yeah.
So the focus of energy is one, soft, and two, not nearly as kind of targeted, and so the energy doesn't go as deep into the tissues. So it feels nice. It's just a very superficial treatment, and that it doesn't mean it's bad. It can actually be super useful, and you can cover a broader area with those if most of what you're dealing with is like muscle tension, muscle tightness, blood flow, lymph movement. It's great. I got nothing against them. But if you're truly looking towards like tendon healing, ligamentous healing, which are much more stubborn tissues to heal, your Theragun's not going to be give you nearly the same therapeutic benefit. And I also can't necessarily comment on its like peer-reviewed like research literature where there's a decent amount on shockwave therapy. So, you've heard of carpal tunnel syndrome before?
Yeah.
Right. So there's a big fibrous sheath that all of your forearm flexors go underneath right here. Mm-hmm. Sometimes that can get a little, you can get some adhesions in there, especially if there's been injury or chronic overuse. Most of the time, the people who get carpal tunnel syndrome, they get it from overuse injuries, mm-hmm. from bad kind of posture, working at a computer all the time, or repetitive motions of really something we're not designed to do. Or in a kind of ergonomically incorrect way. So we'll treat over there a little bit, and then we'll get into your what's called your thenar eminence, but your big fat thumb muscle.
Yeah. Okay.
For lack of a better term.
What does carpal tunnel feel like?
A lot of times pain and numbness in your hand. Again, your median nerve. So it's a lot of times these fingers right here.
So you get numbness like all through your hand because the nerves aren't like.
Usually it spares your pinky.
Really?
And sometimes the ring finger because that's your ulnar nerve.
Oh, so the carpal tunnel nerves go to these.
A lot of times, yeah.
Okay. Yeah, right in there especially is pretty tender.
Okay. Not painful, just a little uncomfortable.
Just uncomfortable.
And that's where you said a focus of some of the like acute pain kind of starts.
Especially when I'm pinching stuff, yeah.
Can you handle a little more intensity there?
In there, yeah. Okay. If you start getting closer to like my wrist, it will be a little much.
Yeah, but right here, we can. Our palms are pretty durable.
Yeah, it's been pretty beat up.
Alright, so we're done with the treatment now. I'm going to put a little bit of like anti-inflammatory kind of pain cream on here, non-medicated. You may feel like tonight, tomorrow, kind of like you got hit by a Mack truck.
Just in my arm?
Yeah, just in your arm, but keep in mind, right, there's definitely some trauma to that tissue. It's actually to stimulate the growth factor. So we'll check in probably tomorrow and then a couple of days down the road just to see how it's doing, how it's feeling, and especially after you get a little bit of use into it. So just know that the next kind of 72 hours are really going to be the time frame in which I'm interested to see kind of how it improves. And then, like I said, we'll see you again next week.
Is there anything I should be doing in the next 72 hours to help with the rehab?
No, you don't. I mean, I would encourage you to not overuse it.
Yeah.
But just go about your daily, your daily work,
Okay.
and outside of that, you don't need to ice it. You don't need to take any pain medication. That's kind of one of the benefits of it is that there's no downtime with this. We want to see how it's going to perform in your kind of normal day-to-day basis. So. All right, there you go. So we'll see you next week.
Cool. Thank you very much.